Hey guys, welcome back to Type 1 Diabetic Warriors. My name is Jim. Today I want to talk about something that I don't think we discuss enough on this channel, and that is, along with keeping your blood sugars under control, something else is very, very important, and the two are related and will affect your health, and that is keeping your cholesterol under control. We're going to dive deeply into that today. If you would hit the like and subscribe button, that will help us to get this video out to more people around the world. Now let's look at the relationship between your blood sugar levels and maintaining a healthy cholesterol level as well.
Misconceptions about type 1 diabetes and cholesterol. There are big implications for diabetics. For individuals with type 1 diabetes, understanding cholesterol is important for managing long-term cardiovascular health. Some common misconceptions could affect how cholesterol is managed in this group. Here are a few key points to help type 1 diabetics better understand cholesterol. 1. Misconception. Cholesterol doesn't affect type 1 diabetics as much as type 2 diabetics. Reality, both type 1 and type 2 diabetics are at an increased risk of heart disease, and cholesterol plays a crucial role in managing that risk. While type 2 diabetes is often associated with obesity and insulin resistance, type 1 diabetics are also prone to higher levels of bad cholesterol, LDL, and lower levels of good cholesterol, HDL. This can lead to atherosclerosis, narrowing of arteries, which increases the risk of heart attacks and strokes. 2. Misconception. Only high LDL cholesterol matters. Reality. Indeed, LDL, low-density lipoprotein, cholesterol is often labeled bad because it contributes to plaque buildup in arteries. However, HDL, high-density lipoprotein, known as good cholesterol, is equally important. Low HDL levels are also associated with a higher risk of heart disease. Many type 1 diabetics have lower HDL levels, meaning they may be at risk even if their LDL isn't alarmingly high. 3. Misconception. Cholesterol comes only from diet. Reality, while cholesterol levels are influenced by diet, the body, particularly the liver, produces most of the cholesterol circulating in the blood. For type 1 diabetics, blood sugar control plays a significant role in lipid metabolism. Poorly controlled blood sugar can increase unhealthy cholesterol levels, particularly LDL, even if dietary intake is well managed. 4. Misconception. Statins aren't needed for type 1 diabetics. Reality. Statins, medications that lower cholesterol, are not just for those with high LDL or older adults. Some type 1 diabetics might benefit from statin therapy even if they don't have high cholesterol levels yet. Due to the increased cardiovascular risks that come with diabetes, statins can be preventive for many type 1 diabetics, helping to reduce their risk of heart disease long-term. 5. Misconception. Exercise always lowers cholesterol. Reality, while exercise can help improve HDL levels and overall heart health, it may not dramatically lower LDL cholesterol for everyone, including type 1 diabetics. Blood sugar control during exercise is also critical. Strenuous exercise without proper insulin management can lead to spikes or blood sugar drops, affecting cholesterol levels over time. 6. Misconception. You don't need regular cholesterol checks if you're young. Reality. Cardiovascular complications often develop slowly over time, and even younger type 1 diabetics can experience early changes in blood vessels. Regular cholesterol monitoring should start in childhood or adolescence for type 1 diabetics, as part of their overall health management. Early detection allows for early interventions that can significantly lower the risk of future complications. 7. Misconception. A low-fat diet is enough to control cholesterol. Reality, while reducing saturated and trans fats can help manage cholesterol, it's not the whole picture. Carbohydrate quality, fiber intake, and overall glycemic control are also important. A diet high in refined carbohydrates or poor in fiber can worsen cholesterol levels even if total fat intake is low. Type 1 diabetics should focus on a balanced diet that supports both blood sugar and lipid control. Key takeaways for type 1 diabetics. Cholesterol management is important for heart health. Both LDL and HDL levels should be monitored. Blood sugar control affects cholesterol, so maintaining good glycemic control can help manage lipid levels. Statins or other cholesterol-lowering therapies might be beneficial, even in the absence of high cholesterol. Type 1 diabetics should work with their healthcare team to understand their risks and develop a plan that includes both lifestyle and medical management to reduce cardiovascular risks.
Okay, so the relationship between your blood sugar levels and your cholesterol is very important. Personally, I get mine checked every time I do an A1C, which is about every 6 months. Some doctors believe you only need to do your cholesterol once a year. I don't agree with that. I always tell my doctor when he does an A1C, make sure you do the full lipid panel. I want to know what my cholesterol looks like. I had this done recently. My good HDL was right where it should be. My bad cholesterol, the LDL, was also in range where it should be. Unfortunately, my triglycerides were a little higher than what they should be, so I have a call back into my doctor to see what we need to do about that. So let me know what you think. Be sure to leave a comment. We always like to review what you all have to say. We have another video coming up for you in a few days. I think you're going to find it very, very interesting. Until then, be well, take care of yourself, take care of that cholesterol as well as those blood sugars. Be well, and we'll talk to you again real soon.